Tuesday. Today, we're going to talk about fibromyalgia and how it relates to functional medicine. And the exciting thing is that functional medicine is very effective in treating a difficult condition of fibromyalgia. So, fibromyalgia is it's a soft tissue condition. Doesn't typically affect the joints, but sometimes it can. There's pain and stiffness all over the body. There's typically depression, anxiety, definitely sleep disorders, and brain fog. So, why am I talking about fibromyalgia on on a functional medicine site that is mostly about COVID? It's because fibromyalgia can mimic many of the symptoms of long haul COVID. Okay, I think I'm back live. We lost connection for a few minutes. Um, Fibromyalgia is very difficult to diagnose. There's no specific lab for it. It usually involves 11 trigger points on the body that are tender, and they can be behind the ears, on the neck, on the chest. Many of them are on the back. So it's very difficult to diagnose fibromyalgia. Again, there's no specific lab test for it. However, when we test fibromyalgia patients, they look very similar to chronic fatigue patients, mold toxicity patients, long haul COVID patients. Although all of the labs are pretty similar. Um, many patients are um, many patients are ashamed of with fibromyalgia. They think oh, it's the you know the mother syndrome of just complaining of stiff, achy, depressed, not sleeping. But it's a real diagnosis. It's a real disease. It's a soft tissue disease. And it can be immensely helped through functional medicine. So let me check in, see what kind of questions I've got. There's one question. What testing do you use for Lyme disease? Yep, supposedly for my fibromyalgia. Oh yeah, I also posted on Lyme disease. So the two important tests for Lyme's disease is I typically use IgM, IgG, PCR test, and then I confirm that with an IgM, IgG Western blot test. And if both of those are positive, Lyme's is there. But it does require some blood tests. Fibromyalgia is not necessarily related to Lyme's disease. They can coexist, certainly. COVID can bring up latent Lyme's disease that maybe was untestable before. But if you've had COVID and now you're suffering from some of the symptoms of Lyme's, like muscle tenderness and fatigue, brain fog, anxiety, depression, sleep disorders, GI distress, then we can test for Lyme's disease because it may have been negative, in the past, but it may be positive now. And again, it's two tests. There's a PCR, IgM, IgG, and then it has to be confirmed with a Western blot. Sorry, I'm still getting over COVID, so I'm a little stuffy myself. think there's another question. Let's see here. CDC testing isn't relying. That's what you use. It shows negative. I know I have it. Again, the test for it is IgM, IgG, PCR, and then IgM, IgG, Western blot. And if those two things are positive, you very likely have it. How I've worked with fibromyalgia patients is really focusing on their sleep. Their sleep is so disrupted because they're stiff, they're tender, they don't feel right in their beds, they don't want to be touched. And so I focus on sleep hygiene. And then I prescribe at first natural things, herbal medications, and uh, hormones like melatonin. Once we correct their sleep and get them sleeping better, most fibromyalgia patients improve. And sometimes that involves some lab testing to see what their inflammatory levels are, to understand what their microclotting is, to understand what their hormones are. Because oftentimes, estrogen, progesterone, testosterone, cortisol, they're off. And so, if we can make some corrections in the hormone balance, fibromyalgia patients, they typically improve. They often have GI distress. So, fibromyalgia patients have IBS, they have gas, bloating, diarrhea, constipation, acid reflux. The level of stress elevates to the point where sometimes they they just can't digest food. They have no appetite, and obviously the two most important things in life are sleep and nourishment, spiritual connection as well. So if we can begin to correct the GI distress, make sure that they're nourished with healthy foods. If we can improve their sleep, and commonly with fibromyalgia, they're depressed, they're anxious, and so there are relationship issues. Now, maybe that's a relationship issue with your partner. Maybe it's a relationship issue with your kids. Maybe it's a relationship issue with your parents. Maybe it's a relationship issue with your work. Maybe it's a relationship issue with nature. You just don't feel connected. And I've read several studies that show loneliness. Thinking back, I've read several studies that show that loneliness or feeling of disconnection from whatever, from your partner, from nature, from your kids, from your friends, from your family. The feeling of disconnection or loneliness is more of a risk factor of mortality than smoking. So for a lot of fibromyalgia patients, I really try to engage them into important relationships, important engagement, whatever that looks like, because that is so powerful and healing. I ask them to visualize fibromyalgia getting better. And how they do that is improving diet, improving relationships, and sleep. And if I can miraculously engage them in improving those things, it's so much better. I mean, I've worked with hundreds of fibromyalgia patients, and they feel forsaken. That's a good word. They feel forsaken. They feel lost and um, discarded because their disease is not real and um, it's undiagnosable, but it's very real. It's so painful. It disrupts sleep. It disrupts relationships. You get anxious. You get depressed, and that's not a very happy life. So let me go back to the question. What do you recommend for extreme gastro disease? Multiple tests of your eat soup, non-salt foods without pain and pain. Um, so for that question, with extreme gastro distress, I would begin with some stool testing to understand some of the microbiome that's going on, some of the organic acids that are going on, and probiotics are so essential for reestablishing the microbiome. So taking a good high dose of a multi-strain like uh, probiotic is a great idea. Sometimes if you're at the stage of hardly eating anything except soup and non-solid foods, what the digestive tract really wants is fiber to function at an optimal level. Nuts and seeds. And it doesn't take much. honestly. It doesn't take much, but having some broccoli, having some carrots, that is so nutritive to the digestive tract. That's a prebiotic. You need probiotics as well. So thinking of yogurt and kefir, those are simple foods. Those are foods on my list that sorry about that. Those are foods on my list that uh, even people with eating disorders, if they begin to introduce foods with probiotics like yogurt, kefir, cottage cheese, um, kimchi, kombucha, and then they add fibrous foods like cruciferous vegetables or asparagus, cucumbers, or fruits. Oatmeal is also an excellent option as well. Um, when you begin to introduce foods, nutritional foods, nutrient dense foods into the digestive tract, it tends to respond in a very positive way, even if you don't have an appetite, even if the servings are very small. So, yeah, prebiotics, probiotics, fruits and veggies, beans, legumes, nuts, and seeds. That would be my answer to you. Let's see if there's another one that's come in. All right. Well, I thank you all for your time. I don't have a lot more information today. If you have questions, please post. We are available for consults. So, um, there's another question that came in. There's a question about SIBO that came in. So, for those of you that don't know, SIBO is a small intestinal disorder. It is very difficult to treat, but through functional medicine, I have helped many people through changing their diet, changing their stress routine, changing their sleep routine, looking at some labs. There are some great SIBO specific labs that can be performed where we can change the enzymes and we can change the probiotics that are living in the digestive tract. But yes, SIBO is a difficult condition. Oftentimes, it presents in teenage years or early 20s. And then symptoms of SIBO get worse and worse and worse over time. Many people don't ever get diagnosed. They just have gas, bloating, diarrhea, fatigue, depression, sleep disorders. Uh, this is all functional medicine stuff. And we can certainly do some laboratory tests and improve the condition. SIBO is difficult to eradicate completely, but if you're at 40% now, we can certainly get you at 90%, which is a vast improvement, obviously. All right, guys. Um, I'm on my last leg here. I'm not feeling so great. So, thank you. Please tune in next Tuesday. I'm not sure what our next topic is next week, but it's a similar topic where we're looking at inflammation, the immune system, the hormone system. It's post-COVID, it's chronic fatigue, it's fibromyalgia, it's mold toxicity. They all really look similar, and how we treat them is very similar as well. We have to we have to investigate a little bit with some labs. But if we can correct the inflammation and the hormones, you all will feel better. So I thank you for your time. Tune in next week and be well.